All right, thank you. And similar to David, I actually was born on Staten Island, so it's nice to be back. I've been out in the West for a while, so it's good to be back here on the East Coast.
Not here.
So I'll be talking about the work that we've been doing on COVID specifically, but broadening it a little bit and talking about some trace organics as well. So we'll get some chemistry and microbiology in the presentation. All right, so my first foray into wastewater epidemiology is really sewer anthropology. Everything that we do as humans winds up in a sewer. And so it's a great resource for information to learn about what's going on in the community. So back in 2010, we looked at wastewater during the Super Bowl. Before the Raiders came to town, we didn't have a football team. And so the Super Bowl was never in Vegas, but our population increased by about 300,000 people on Super Bowl weekend because people like to come to Vegas and gamble and do all that fun stuff during the game. And so that has an impact on infrastructure. And so what you're seeing here in these lines, these are the wastewater flows into our major wastewater treatment plant that receives the wastewater from the strip. And the pink line there at the top in the first box, and then at the bottom in the second box, that's the flow during Super Bowl weekend, specifically on Super Bowl Sunday. And so right before the Super Bowl starts, it's a little bit earlier on the West Coast, so about 3:30 p.m., you get this surge in wastewater flows as everybody's running to the bathroom before the game starts. After the game ends, you get much lower flows than you have on a normal day. So that's 2009, and then this is 2010 when we actually collected our samples. So you can see the impact on flow at the treatment plant. But we wanted to look at what the impacts were on water quality, in particular looking at trace organics and illicit drugs. So I'm just providing one example here with cocaine metabolites. This is the major metabolite of cocaine as it goes through people's bodies. And this is just one set of samples. So I don't know if this would be reproducible in future years, but on this particular day, comparing it to a baseline weekend, the level of this metabolite was 50% higher during Super Bowl weekend. And then on a normal weekend, we saw higher prevalence or higher concentrations of methamphetamine, for example. So you can see the impacts on flows and on the things that we actually see in the wastewater. So that brings us to SARS-CoV-2 and COVID. So if you don't know yet, I don't think that's possible, but SARS-CoV-2, the virus that's responsible for COVID, has been around for about 2.5 years now. So this is a project I never expected to be doing still to this day, and you'll see why we're still doing this in a little bit. So this is, or at least at first, it was thought to be primarily a respiratory virus. And then pretty quickly, we realized that it winds up in fecal samples, perhaps because it causes a secondary infection in the GI tract. So you get replication of the virus and then winds up in fecal samples and then in sewage. And so pretty early on in the pandemic, people realized that wastewater could be a crystal ball for understanding what was happening right now and then what could happen in the future in terms of infection rates in the community. And so I really like this example. This was January 2021. So this is the San Diego Zoo, the silverback gorillas. There was an outbreak in that silverback gorilla habitat. And so the way that they were able to confirm that they were infected with SARS-CoV-2 was through fecal samples, because you obviously don't want to take a nasal swab of a gorilla, I guess. So I like this example because it shows you that connection to, in the public health sense, to wastewater. So back March 2020, kind of like with the rest of the world, we had a stay-at-home directive in Nevada. So Vegas went dark. So for locals, it was a really interesting experience because there was nobody on the strip. All the hotels, all the casinos were closed. And so you could go down and it looked like one of those apocalyptic movies where there's nothing happening in one of the busiest cities, busiest tourist destinations in the world. So it was an interesting experience to be a local there. But again, first thing we looked at were the impacts on wastewater flows. So again, this is the wastewater treatment plant that gets all the flows from the strip. And so you can see in those blue circles there, the impact of shutting down the strip in terms of the wastewater flows. So it went from a little bit over 100 million gallons per day down to about 90 million gallons per day almost instantly. Not only that, so we saw the decrease in the flow, but what we also saw was the peak flow. There was a shift in time. And so I guess with people working from home, they started the day a little bit later. And so the peak flow was a little bit later in the day as well. So peaks came down and moved later in the day. So in terms of wastewater surveillance, we're not taking nasal swabs. We're basically swabbing something else, and we're getting a view of the entire community. So with one sample, we can basically see what's happening among 10,000 people, for example, as opposed to taking 10,000 nasal swabs. So the study that we've been doing specifically at the Water Authority is, it's expanded over time quite a bit. We are now sampling every Monday, and usually we can get results by Tuesday afternoon. We started with one site back in March 2020, that became 2 sites, and now we're doing 7+ sites a week, which gives us the ability to essentially swab all of Southern Nevada every Monday morning with those samples. And then we also had short-term monitoring of a homeless shelter, and I'll talk about that briefly as well. So this gives you a rundown of Southern Nevada. This is a map of the area and the different samples that we're collecting. So we have facilities that range in flow from about 0.8 million gallons per day up to 100 million gallons per day. And that 100 MGD facility is the one I've been talking about. That's the one that gets the flows from the strip. And we'll talk about that later in terms of the interesting things that we're seeing there. We also have different sample types. So we have grab primary effluent, composite influent, grab influent. And we're getting valuable data from each of those despite the potential complications of those different sample types. So what I've said from the beginning is that even if you don't have a composite sampler, for example, there's still value in going out and just grabbing a grab sample and seeing what that tells you about what's happening in that community. At one facility, we have the ability to look at trunk lines that come from different parts of the city, so we can break down that particular facility into those different areas to give us better resolution. So once we collect these samples, we do 2 different things, and this is pretty common for all the wastewater surveillance programs that are out there now. So at SNWA, we specifically look at the concentrations. So what is the concentration of every sample that we collect? What does that tell us about the infection rate in the community? And then we also give those samples to our collaborator at UNLV, Dr. Ed O, who does the sequencing work. So we figure out the concentrations, and then Ed figures out which variants are dominant in those particular samples and how that's changing over time. So here's the roller coaster of COVID that is pretty much common basically across the world at this point. So you see all the different peaks and valleys that happen as different variants came on the scene. And every time you see that drop off, that's when I thought we were done with this project. And then pretty quickly after that, you would see it come back up again. And then once we got to Omicron, I realized I'd probably be doing this for the rest of my career because it's never going to end. But for this presentation, I'm going to focus on a few different parts of this. 1 was the early pandemic, 2 is the winter spike, 3, the Delta wave, and then lastly, the Omicron surge that we saw about 6 months ago, and it's now turning into another Omicron surge. So early in the pandemic, taking a step back, we're the Southern Nevada Water Authority, so we're the drinking water utility. So one thing that's overlooked when I give these presentations is that we typically wouldn't be doing something like this. But we have a great research and development group. We have the analytical capabilities to do it. So that gave us the opportunity to jump on this pretty early on back in March 2020. So the first thing we wanted to do, and this goes back to what David was talking about with potable reuse. Our major goal in Southern Nevada is to get every drop of water back into what's called the Las Vegas Wash, which then feeds into Lake Mead. And so there's that direct connection to wastewater in Southern Nevada. And so we want to make sure that we understand what's happening with the drinking water supply because of that wastewater influence. So about 1% of our drinking water is treated wastewater, or our source water is 1% treated wastewater, and that's based off of sucralose monitoring. And so we wanted to make sure that this wasn't going to be a drinking water risk. So pretty early on, we figured out this isn't a risk to the public health in terms of drinking water, and that allowed us to focus on the implications for public health on the upstream side. So what is this information telling us about what's happening in the community in a public health or disease transmission context? So assessing the drinking water risk, we can check that off. We didn't have to worry about that. That allows us to develop and finalize methods and then make sense of the data. So this is showing a hypothetical example of the red dots being observed wastewater concentrations, the green line being what we might model or predict based off of what we're seeing in terms of cases. So if you have a certain number of cases per day, what should we see in the wastewater? And so we have what should we see versus what we're seeing, and that allows us to get an idea of how well our clinical testing or clinical surveillance is working. So if you see red dots above the green line, for example, that's an indication that there's more in the wastewater than you would expect based on the cases. So maybe we need to be doing more clinical surveillance in that situation. And so that was one of the goals early on, is how do we interpret the data that we're seeing? Then we get to phase 2 with the winter spike. And so this is, at least out west, we had the Epsilon variant that was coming from California, and then we had the Alpha variant that was becoming common across the world. And so this gray area represents the part that I'm going to show you next. And this is where we expanded our program. So we had the first facility, we brought on the second one, and then this is the point where we start getting into 7+ samples per week across all of Southern Nevada. So we have the different facilities across the top there, and then basically arbitrary color coding. So green represents 10 to the 4th, orange is 10 to the 5th, red is 10 to the 6th, purple 10 to the 7th, and we even had almost a 10 to the 9th in our smallest facility. So this is a really small community. Because of that small size and the fact that it's a grab sample, it's more susceptible to spikes in concentration. And you can see that that's the highest concentration that we've ever detected in 2.5 years. And that was during that alpha spike in around Christmas of 2020. So I've lost track of years and time because of COVID. And so I just think about it in terms of variants now. So I don't know months and years, but I know which variants were prevalent at certain times. So we had the start of the surge in the winter where we started to see concentrations creep up. Then we got to that peak where we saw that 10 to the 9th, for example, but we were seeing 10 to the 6th, 10 to the 7th a few times in some communities. Then it came down. I thought we were done again. And then it started to hover for a while, and then we started to see it come up again. So it was around this time that we started working with Dr. Ed O at UNLV. A lot of wastewater surveillance work was starting to get more publicity in the media. And so we were doing a lot of media interviews at the time. And so I always give him a hard time because when they did his interview, they gave him a really clean toilet. And then the toilet that they used for me has that nasty ring on it. And so now I'm associated with that. So in terms of sequencing, phase 2 is where sequencing for our project really came online. And so I'm just providing a few examples here. So with Ed's work, we were able to detect the alpha variant in wastewater a month before it was confirmed in clinical cases in Southern Nevada. So there's a lot of examples of how wastewater gives you a lead time. That's one example for us here with the sequencing work. And then we also have the Epsilon variant. This brings me back to the homeless shelter. And so we collected weekly samples at a homeless shelter during November, December 2020. And during that time, that was my first opportunity to look at grab samples from a manhole. And you can actually see the different samples that we collected in 5-minute intervals and how different it is. Because I think in some sense, people think that wastewater is this homogeneous mixture of nastiness, but in fact, it's individual toilet flushes, it's people turning on sinks. And so you get that high variability when you get to a manhole sample. But every sample that we collected from that homeless shelter was positive at the time, which isn't particularly surprising because basically every sample that we've collected from any wastewater system has been positive since March 2020. But getting that grab sample from a manhole was surprising to me that we were able to see it in every sample. And so when Ed sequenced it, he was finding the Epsilon variant at that time, which was the one that was prevalent in California and starting to become prevalent in Southern Nevada. But we also had examples like the Beta variant at the time that was never detected in Southern Nevada wastewater, but there were confirmed cases. So that gives you an idea of the sensitivity of the methods, that there might be people out there, as long as there's just a few of them, that we won't be able to detect in wastewater, at least in a large system where you have a lot of contributions from commercial, industrial, and domestic wastewater. So another thing that we started doing during this phase 2 is, again, trying to interpret the data that we were seeing. And this is a very simplified explanation of how we can do this to try to estimate what is the true number of infections in the community. So it's a simple equation up there, but there's a lot of complexity in how you come up with the numbers that feed into this equation. So the way that we did it, we wanted to look at what was the total viral load that was coming into all of our facilities. And so if you have kids at home and they ever ask you, why do I need to do calculus and learn how to integrate? Someday they might be integrating poop that's going into a wastewater treatment plant to understand what's going on. So basically we integrated the concentrations we were seeing at all those facilities. And so as an example there, for facility 1 from March 2020 to April 2021, there was about 83 quadrillion gene copies that went into facility 1 during that time based on the data that we're collecting. So then you need to know, how much does somebody shed over the course of an infection? And so this is a study that was actually pretty early on looking at fecal shedding, so taking stool samples, looking at how much SARS-CoV-2 was in that stool sample. And so there's going to be a lot of variability from person to person. But what we were able to do is take CDC seroprevalence data. So in spring 2021, CDC was taking blood samples. So people would go in for blood work. That blood work would be tested for various things. The CDC took that as an opportunity to look for antibodies. And so that gave us an opportunity to see what is the true level of infection in the community, because not everybody goes and gets tested. And so we took that seroprevalence data, assumed that was the true number of infections in the community, and used that to calibrate our SARS-CoV-2 data to figure out what the fecal shedding rate was. And so that dashed dotted line there is what we calibrated, and then basically put it onto or overlaid it on the Wolfel shedding data to see what does that look like if you backtrack back to like day 0 of an infection. What is the fecal load during that time? And then how does it drop over time over the course of about 25 days? And again, if you integrate that, I guess you guys see everything. So there's the closed captioning. So at the bottom there are 240 billion SARS-CoV-2 viruses over the course of an infection. So if we take the total viral load divided by the 240 billion viruses per infection, that gives us how many infections we have in each one of those individual systems. So again, facilities on the left, and I'm going to highlight the estimated infections based off of wastewater, the reported infections that are confirmed through clinical testing, and then on the far right is what I'm calling the ascertainment ratio, or the underestimate for how many infections are in Southern Nevada at this point in time, which is April 2021. So in this case, over all of Southern Nevada, that 3.7 there at the bottom is an estimate of basically 3.7-fold undercount of the true number of infections relative to the confirmed case count. So how can we use something like this? So at the time, there was the idea that you would probably only get infected once with SARS-CoV-2. So if we had the number of people that were confirmed, we know that that's probably an undercount, but we can use wastewater to get the true number of infections in that community. Then if you throw in people who had gotten the vaccine, which again, the vaccine was preventing infection at the time for most people, we can get an idea of how close we were to herd immunity, or get at least a better value of that. So Omicron changed that calculation almost entirely, but back then we thought vaccines plus people who had been previously infected would get us closer to herd immunity, and wastewater might give us a more accurate representation of how close we were. So we can also look at this data in different areas. So for example, that 7%, that means that only 7% of the population was theoretically infected at that point in April 2021. So you can see how that value changes in these different communities. So 7% was the lowest, 54 to 59% were the higher numbers. But that 7% means that a lot of people weren't infected in that community. And so if you release those people out with the virus spreading in the community, they were more susceptible in general compared to other places. So that might be a place where you prioritize vaccination because you have so many susceptible people in that particular area. And then also looking at demographics, for example, one of the things that's notable about that community is that it's a retirement community, and it's also a higher income area. And so theoretically, you have people that are more likely to stay home because they're not working, and you have people that are more able to stay home, higher income areas, more likely to work from home. And so you have less exposure in that area, and that's why we might see less of that virus in that community. So the next thing that happened, virus concentrations came down, and now all of a sudden they started to go up again because of the Delta variant. And I put this little snapshot here of the Florida COVID surge. So not every place uses ozone for treatment, but in Southern Nevada, for example, we use ozone for drinking water treatment. Ozone's used at one of our wastewater treatment facilities. In order to generate ozone, you need oxygen. And so in Florida, they had a problem because they had facilities that were using ozone. They didn't have enough oxygen because so much oxygen was being used in the hospitals that it made it difficult to treat their water in Florida. And so they were asking people, don't water your lawn, don't use water if you don't have to, because we can't treat all the water that's needed right now. So that was a side effect of the Delta surge that was happening during that time. So what we noticed in the wastewater data is that we were seeing similar concentrations during the Delta surge as what we had seen during the previous, what I'll call the Alpha surge. But what was interesting is that the caseload was much lower. And so there were a few possible explanations for this. One, the most likely one being under testing. So people were essentially done with this. They didn't want to go out and get tested anymore. It wasn't being forced upon them. So they decided to not get tested. So that was one possible example. Another one, at least in Southern Nevada, was a tourism impact. And I'll talk about that later as well. Potentially a change in fecal shedding. So as these variants change, people might shed different rates through stool samples, for example. Or more likely, you have this combination of factors that are causing that discrepancy that we were seeing. So now we go on to the Omicron surge. I'll get back to the tourism question towards the end of the presentation. So with the Omicron surge, another thing that I saw that was interesting is over the course of the pandemic, sports would tell us a lot of things about what was happening. And so it was during this time where the NFL season was going on, and basically every NFL player was testing positive and they didn't know what to do because games were being canceled and so forth. So you could see basically how infectious this particular variant was based off of what was happening in sports. And we saw the same thing happening in the wastewater again. And so one of our sampling locations is a manhole that gets wastewater primarily from the Las Vegas Strip. So it allows us to mostly isolate what's happening in the tourism corridor, and then compare it to what's happening in the broader community with the locals. And so with Omicron, what we saw is that the Las Vegas Strip manhole was the first place that we saw Omicron pop up in the wastewater in Southern Nevada. And so that was an indication that people outside of Nevada were being exposed to Omicron first, and it hadn't quite started spreading in Southern Nevada among the locals. So not necessarily that visitors were spreading it to locals, it's just that it hadn't gotten there yet and started spreading up, at least at that point. But you can see in just a matter of weeks, the case data in red for facility 1, that's our big facility, you can see it start to spike because people started to get Omicron and get infected and get COVID. So this is actually the wastewater data. So again, the data on the left is from the manhole. The green data there on the right is actually the wastewater from that particular treatment facility. And then the red data is the caseload. And so even before Omicron hit, we started to see an increase in wastewater concentrations. We didn't see the same level increase in the case data, but it was an indication that it was spreading in the community. And so it was possibly Delta that started to spread. But then you can see once Omicron was introduced, we got a spike in both. So you got the cases, you got the wastewater. The other interesting part here is that we saw the wastewater peak, but we still saw cases continue to roll in. And so the wastewater peaking and starting to come down was an indication that we had hit a peak. And so conditions weren't getting any worse at that point. And so it looked like it was getting worse in the case data, but wastewater was telling us that we had peaked and conditions were actually improving. And then those both came down pretty quickly. The other interesting part about Omicron and Delta was that those particular variants took over very quickly and completely. So with Alpha and Epsilon, we would get hits sporadically of those two, but it never completely took over like Delta and Omicron did. So once Delta became prevalent, once Omicron became prevalent, those were the only variants essentially that you saw in the wastewater. And so again, another indication of how infectious they were. So coming back to this tourism question, I mentioned that Vegas went dark, tourism plummeted because basically went to zero. And then over time, as people felt comfortable traveling again, tourism started to increase until the point more recently where we're almost at pre-pandemic levels again. So like I mentioned with Omicron being detected at that Las Vegas Strip manhole, it seemed like visitors had a higher prevalence of Omicron than the local population, at least early on. And so when we looked at facility 1, once it eventually started popping up there, and I mean Omicron in that sense, Omicron was higher prevalence at facility 1 than what we were seeing in other places. So facility 1 is a combination of locals contributing wastewater and the Las Vegas Strip. So you can see that the prevalence of Omicron was 38% on December 13th, and it was 80% on December 20th. Now, if we look at the other treatment plants that aren't impacted by the strip, on those same dates, Omicron prevalence was 4% and 48%. And so the theory here is that visitors were not necessarily contagious, but they were possibly recovering from a COVID infection, still shedding into the wastewater, but they were shedding a lot of Omicron. And so more so than what we were seeing in the local population. So if we take those those dates and those different plants, we could develop a system of equations. And we got an idea that visitors were possibly contributing at least 60% of the SARS-CoV-2 load to facility 1 as compared to the local population. And so that's important because if you're trying to gauge or use wastewater to gauge the level of infection in the community, and you have a big tourist contribution, or in New York, for example, you have a big commuting population, that can really throw off the numbers, and that needs to be accounted for. And so that was a really interesting use that, at least in my perspective, of how to use wastewater data and tourism data, for example, to get an idea of what might be contributing to the load that you're seeing. So coming back to this ascertainment ratio concept, again, this is the X-fold undercount. So I talked about the 3.7-fold undercount across the broader community. When we got to Delta, for example, these were the ascertainment ratios for Clark County, which is facility 1. And you can see how much higher they are compared to City of Las Vegas and North Las Vegas. And so again, I think that's possibly because of the tourism impact. And so if we assume that 60% of that viral load is coming from visitors, we can adjust that number to get an idea of what the undercount is for the local population. And once we take out that 60%, the Clark County numbers are a lot more in line with City of Las Vegas and North Las Vegas, which are the major population areas in Southern Nevada. The other interesting thing is that during this Omicron surge, we had most of our sewer sheds were kind of in the same ballpark in terms of cases per 100,000 people. But that gray line there in the middle is Boulder City, which is a little bit more rural community. It's about 25 minutes outside of the greater Las Vegas area. So you can see their case data is much lower than the other sewer sheds, which is possible because they're more isolated. There might be less infection in that community. But when we looked at the undercount there, that ascertainment ratio was much higher during December and January when their case data was showing up as being lower. And so that's an indication that there was an undercount of cases in that area because their ascertainment ratio was so high. And so coming back, using the fecal shedding calibration that I talked about earlier to get an idea of how many infections were happening, just in January, if we use that same calibration data, 475,000 infections happened in January in Southern Nevada based off of the wastewater data, which is about 20% of the population. So again, showing you how bad Omicron was in Southern Nevada. So to conclude here, it took a long time to get people to buy into this, but it was really interesting when we finally got rid of our mask mandate. Governor Sisolak actually cited the wastewater data as one of the metrics that they used to feel comfortable taking away the mask mandate as Omicron started to subside. So that was an interesting, I won't say conclusion because it's still going on. We're still looking for SARS-CoV-2, but it showed that eventually public health policymakers started to buy into this concept of wastewater surveillance and see it as a valuable metric that they can use. So I'll close on this one, the path forward for wastewater surveillance. Like I mentioned, I'm probably going to be doing this forever, not just for SARS-CoV-2, but what we're learning or what we have learned with all the work going on with wastewater surveillance. And again, pulling this back into what David was talking about, looking at how we can better understand potable reuse systems and the risk of potable reuse systems, how to design these systems. We've learned so much about the level of infection in the community and how it translates to what you see in wastewater, that we can do this for other things. So like enteric pathogens, for example, for norovirus, for adenovirus. These are things that are relevant to the design of potable reuse systems. And I think we're going to learn a lot about that and be able to apply that in the design of those systems. And so other things that we are now expanding to, I mentioned illicit drugs early in the presentation. We're now doing illicit drugs as of a few weeks ago. And so we'll start looking at each of these sewer sheds, looking at concentrations and seeing how they're changing over time. And by location. Antimicrobial resistance is going to be a really important one as we move forward. I mentioned enteric viruses, influenza, similar to SARS-CoV-2. The two that are becoming more focused upon are Candida auris, which is a fungus that is often resistant to antifungal medication. So that's always been a target for CDC when they developed the National Wastewater Surveillance System. They wanted to look for C. auris. And then monkeypox is the new one. And so interesting story about monkeypox that I'll close on is that we had a call from a local news agency and they wanted to talk about what we were seeing in terms of monkeypox. And so I told them we weren't looking for it. We didn't think it was a significant concern yet, and so we didn't really have that as a high priority. And so when the news story came out, it was that the Southern Nevada Water Authority was already looking for monkeypox and finding monkeypox. And so now we were looking for monkeypox in wastewater. So that was kind of forced upon us, but it'll be an important one. It's the reason that wastewater surveillance has been pushed as being so valuable to public health for something like this. Something jumps onto the scene. And instead of taking it months to get it ramped up, because of what we learned with SARS-CoV-2, we can jump right on that and make sure that it's not being circulated in the community, for example. So I will close there and I'll put on the acknowledgements. Feel free to ask questions. I'll be around. I have some trace organic data that I passed up on, but I'd be happy to talk about that and let you know what we're seeing so far. So thank you.